Dyslipidemia refers to unhealthy levels of one or more kinds of lipid in your blood. Blood contains three main types of lipid: high-density lipoprotein, low-density lipoprotein, and triglycerides. If the levels of low-density lipoprotein are too high or the levels of triglycerides are too high, then it means you have dyslipidemia. It also means your high-density lipoprotein levels are too low. Having HDL is good because it helps remove LDL from blood. LDL cholesterol is a bad type of cholesterol as it can build up and form clumps in the artery walls. This builds up can cause heart attack. Triglycerides are formed from the food calories but don't burn right away. This is what you use when you need energy, but when you eat so many calories, then what you need, triglycerides, get built up. Dyslipidemia is divided into two types, primary and secondary. Primary dyslipidemia comes through genes, and secondary dyslipidemia is acquired, which means it's developed from other issues like obesity or diabetes. Hyperlipidemia is often confused with dyslipidemia. Hyperlipidemia is caused when LDL levels are high, but dyslipidemia is caused by blood fats being either low or high. Hyperlipidemia is a major cause of atherosclerosis, and it's included conditions like ischemic cardiovascular issues, coronary heart disease, peripheral vascular disease. Some of the primary dyslipidemia are
familial combined hyperlipidemia. This is the common type of dyslipidemia and is caused mostly from inheritance, which is due to the high level of LDL cholesterol and high level of triglycerides. If you have a familial combined hyperlipidemia, you will develop these issues in 20s. You are also at risk of heart attack issues and early coronary artery disease.
familial hypercholesterolemia and polygenic hypercholesterolemia.
Total cholesterol can be calculated by combining LDL and HDL, and half of your triglycerides, and these two types are caused due to the high levels of total cholesterol. Total cholesterol levels should be less than 200 milligrams per deciliter.
Familial hyperapobetalipoproteinemia.
These conditions means you have a high levels of apolipoprotein B, a protein that is part of your LDL cholesterol. As per 2018 guidelines on cholesterol and blood management published in Journal of the American College of Cardiology, these are the acceptable levels of cholesterol in adults. All the values are in milligram per deciliter and are based on fasting conditions.
Recommended cholesterol levels for adults: good cholesterol levels, total cholesterol less than 200 milligrams per deciliter, HDL cholesterol 60 milligrams per deciliter or higher, ideal 40 milligrams per deciliter or higher, acceptable for women, LDL cholesterol less than 100 milligrams per deciliter, less than 70 milligrams per deciliter. If the person has coronary artery disease, triglycerides less than 149 milligrams per deciliter, less than 100 milligrams per deciliter is ideal. Moderate cholesterol levels: total cholesterol between 200 to 239 milligrams per deciliter, LDL cholesterol between 130 to 159 milligrams per deciliter, triglycerides between 150 to 199 milligrams per deciliter. High cholesterol levels: total cholesterol 240 milligrams per deciliter or higher, HDL cholesterol higher than 60 milligrams per deciliter, LDL cholesterol 160 milligrams per deciliter or higher, 190 milligrams per deciliter or higher is very high, triglycerides 200 milligrams per deciliter or higher, 500 milligrams per deciliter or higher is very high. Low cholesterol levels: HDL cholesterol less than 40 milligrams per deciliter. Recommended cholesterol levels for children.
In children, good cholesterol levels are defined as a total cholesterol below 170, HDL cholesterol above 45, and LDL cholesterol under 110. Triglycerides should be less than 75 for ages 0 to 9 and less than 90 for ages 10 to 19. Borderline levels are total cholesterol between 170 to 199 and HDL cholesterol between 40 to 45. LDL levels between 110 to 129 and triglycerides between 75 to 99 for ages 0 to 9 and 90 to 129 for ages 10 to 19 are considered moderate. High cholesterol in children is indicated by the total cholesterol over 200 and LDL levels of 130 or higher, Triglycerides should not exceed 100 for ages 0 to 9 and 130 for ages 10 to 19, while low cholesterol is defined as HDL levels below 40 in children.
Drug therapy for dyslipidemia. There are natural ways to reduce LDL cholesterol by diet modification, but one can achieve only 10 to 20% reduction for cholesterol levels. If lipid level are on raise after 6 months, NCEP recommended that cholesterol-lowering agents should be used for therapy. Patient with high LDL cholesterol level should start therapy by using drug sooner, as it is unlikely that a patient with LDL level 130 per DL with diet. Drug therapy is never a substitute for diet and exercise. Patients should always continue with that. In patients with hypercholesterolemia, HMG, CoA reductase inhibitors are the drugs of choice because they reduce LDL cholesterol most effectively. Statins are commonly prescribed to lower cholesterol level by blocking the cholesterol production in the liver, reducing the LDL cholesterol and decreasing the risks of cardiovascular events. Other medication, niacin helps to lower cholesterol, increase HDL level, and decrease triglycerides. Bile acid reasons reduce the cholesterol level and LDL level, while cholesterol absorption inhibitors like ezetimibe work by reducing the cholesterol absorption from the diet.
In conclusion, dyslipidemia is one of the reasons for cardiovascular events and mortality. There are drugs that are proved to have shown effectiveness and like statins and nicotinic acid. The standard care for all patients who have high risk of CVD or cardiovascular disease are statins. And ezetimibe is also now proved to have effectiveness on CVD risk along with the statins. Human genetics and clinical trials have supported the role of the LDL or low-density lipoprotein in CVD and in supporting treatments to reduce LDL. Several researchers are researching on targets that lower the TRL through human genetics.